Hello, my name is Jeff Patterson, Chief Executive Officer of Nacogdoches Medical Center, and welcome to another episode of Ask a Nac Doc. Today I'm here with board-certified dermatologist Michaela Overturf. Welcome.
Thank you.
We are super excited to have you here, and it's a really pertinent time to have you because July is UV Awareness Month. Can you tell us a little bit more about that?
Every July we celebrate UV Safety Awareness Month. We use that as a reminder for all of the harmful effects of ultraviolet radiation and also to make the public aware of different tips and tricks to keep everyone safe.
Okay, so I was out at the pool this weekend and outside of wearing a big hat, what are some SPF tips or some other things that we can do to keep us safe?
So sunscreen is definitely going to be the most important player. You want to make sure that you've got a broad spectrum sunscreen, meaning that it protects against both UVA, which is the spectrum that causes premature aging and wrinkling, and also protects against UVB, which is the spectrum that's more likely to cause skin cancers and precancers. It needs to be at least SPF 30 or higher, and you want to be reapplying at least every 2 hours because you're sweating or you're in the water, but definitely every 2 hours. And please make sure you're taking care of your little ones who can't protect themselves.
What are some things outside of redness in the skin that folks can look for to help sure they're looking after being safe?
Speaking of protecting your little ones, a lot of the sun damage you develop starts when you're really young. As you get older, you may start to notice that you're getting more spots, maybe brown, maybe pink. Maybe you're getting something as you get older that's kind of scaly, and those could all be things that are not healing. Those could all be signs of a problem. Also, the worst kind of skin cancer, the melanomas that we worry about, the things to look for with those are anything dark in color, anything that's got an irregular border, anything that's color is maybe changing, anything that's growing. Those can all be signs of something to be concerned about and something you might need to make an appointment for.
Dr. Overturf, we've talked about how sun is harmful, but what are some ways that sun is beneficial to folks?
One of the biggest benefits of sunlight is its ability to help produce vitamin D in the skin, but it's important to realize that you don't need as much sun as you think to do that. There are lots of variables in play, including your skin type, how likely you are to burn, the amount of clothing or the amount of skin exposed. But if you've got, say, your arms and your face exposed and you're outside at noon in Texas, maybe about 8 to 10 minutes is all you need to generate the recommended amount of vitamin D. And vitamin D is stored in fat, and so if you miss today or tomorrow, doesn't mean you need to catch up later this week.
That's good information to know. Thank you so much, Dr. Overturf, and thank you for joining us again for another episode of Ask a Nac Doc. Take care.